Hello, my name's Deborah Mukherji. I'm a medical oncologist at the American University of Beirut, and I'm really looking forward to the upcoming ESMO World GI meeting. This year, I have the honour of chairing a session with Professor De Croo on colon and rectal cancer early disease settings, and we're going to be hearing some really interesting new abstracts, including some new data about the combination of radiation and immunotherapy and chemotherapy in the neoadjuvant therapy for locally advanced rectal cancer. I'm very, very happy that my colleague, Dr. Ali Shamsuddin from the American University of Beirut, will be presenting an investigator-initiated study involving sites from Lebanon and Jordan on this topic, and we have some really nice data to share, which may be hopefully the basis for forthcoming larger clinical trials. We'll also be having a really nice discussion with some leading experts in the field about some of the controversial topics in the management of rectal cancer. We have some cases that we'll be discussing together from different points of view, and that should be a really lively debate and discussion. On Saturday the 3rd, I'll be involved in a session with Dr. Tabanero about the adjuvant treatment of colon cancer. And again, we'll be chairing a really interesting debate about the duration of chemotherapy for adjuvant colon cancer treatment, whether we can adopt the shortening of chemotherapy duration and for which patients that's appropriate for. And I think we'll see some interesting data and have some interesting discussion about how to use new circulating biomarkers to really stratify patients for adjuvant therapy and to risk stratify patients to try and either intensify or de-intensify their adjuvant therapy. And then finally, on Saturday, I really have the pleasure of being involved in the Women in Oncology session. We have a really great panel discussion. Dr. Ruiz Garcia from Mexico City will be giving us an introductory lecture, and then we'll have plenty of time for answering questions from the audience and a panel discussion about how to elevate women leaders in oncology research. And that should be a really wonderful end to our really rich program.